Hello, friends. Dr. Mike here. I am 92 years old, and I've seen a lot in my life. Over 7 decades in medicine and countless patients with all kinds of conditions. Today, I want to talk about something that might surprise you. Why healthy people sometimes still have high blood pressure. You might think that if you eat well, exercise, and avoid stress, your blood pressure should be perfect. But reality is a little more complicated than that, and I want to explain why. First, let's start with the basics. Blood pressure is the force of your blood pushing against the walls of your arteries. When it's too high, it can damage your heart, your kidneys, and even your brain over time. We often think of high blood pressure or hypertension as a lifestyle disease. And yes, things like poor diet, obesity, and lack of exercise can contribute. But even if you do everything right, sometimes your blood pressure still climbs. Why? One reason is genetics. Some people are simply predisposed to higher blood pressure because of their genes. I have patients whose parents and grandparents all had hypertension, even though they lived very healthy lives. Genetics affects how your kidneys handle salt, how your blood vessels respond to stress, and even how your hormones regulate blood pressure. You can't control your genes, but knowing your family history helps you understand your risk. Another factor is age. I know I'm 92, and I can tell you age matters. As we get older, our arteries naturally become stiffer. That means your heart has to pump harder to move blood through the body, which raises blood pressure. Even the healthiest person can see an increase as they age. It's not a failure on your part. It's just biology. That's why routine blood pressure checks are so important, even for young, healthy people. Then there's stress. Many people assume that only unhealthy people experience stress, but that's not true. Even someone who eats clean, exercises regularly, and sleeps well can have stress from work, family, or even just worrying about their health. Stress releases hormones like cortisol and adrenaline, which can temporarily spike your blood pressure. If this happens frequently, it can contribute to long-term hypertension. Meditation, deep breathing, and mindfulness can help. But stress is not always completely avoidable. Another hidden culprit is sleep. Poor sleep or sleep disorders like sleep apnea can raise blood pressure. Even healthy people can have undiagnosed sleep apnea. When your body doesn't get enough restorative sleep, your sympathetic nervous system, the part that controls fight or flight, remains active, which keeps your blood pressure higher than it should be. So don't underestimate the power of a good night's sleep. I've seen patients lower their blood pressure just by addressing sleep issues. Diet also plays a role, even if you think you're eating healthy. Sodium is the usual suspect, but even some natural foods contain more salt than you might realize. Some people are more salt sensitive than others, meaning their blood pressure rises more with the same amount of salt. Potassium, magnesium, and calcium also affect blood pressure. So a diet that seems healthy in general might still leave your blood pressure higher if it's not balanced. Hidden health conditions can be another reason. Sometimes high blood pressure is secondary, meaning it's caused by another problem. Conditions like kidney disease, thyroid problems, or hormonal disorders can all raise blood pressure, even if you're otherwise healthy. That's why regular checkups are so important. It's not just about lifestyle. It's about detecting underlying issues early. Now here's an important point. Sometimes blood pressure can rise temporarily due to daily fluctuations. Stress, caffeine, dehydration, or even talking to your doctor can make it spike for a few minutes. This is why we usually take multiple readings over time before diagnosing hypertension. Don't panic if your blood pressure is slightly high one day. Look at the bigger picture. So what should you do if you're healthy, but your blood pressure is high? First, don't ignore it. Even mild hypertension increases the risk of heart disease and stroke over time. Track your blood pressure regularly at home or with your doctor. Make lifestyle adjustments if needed, like moderating salt, staying active, managing stress, and sleeping well. And importantly, consult your doctor about whether medication is necessary. Sometimes even healthy people need medication to protect their heart and arteries. I want you to remember this. High blood pressure is not always a sign that you're failing at being healthy. It's often a combination of genetics, age, lifestyle, and hidden factors beyond your control. What you can control is awareness, monitoring, and taking proactive steps. That's why I always tell my patients, knowledge is power. The more you understand your body, the better choices you can make to protect it. At 92, I've learned that medicine is not just about curing disease. It's about prevention, understanding, and adaptation. Even if you live a healthy life, you must pay attention to your numbers. Blood pressure is one of those numbers that silently affects your long-term health. Don't wait for symptoms. By the time you feel something, damage may already be happening. Stay vigilant and make small but consistent changes when needed. Finally, remember that health is a lifelong journey. There will always be factors you cannot control, but there are many things you can control. Eat well, move regularly, manage stress, sleep properly, and follow your doctor's advice. And most importantly, don't blame yourself if your blood pressure is high despite your efforts. The body is complex, and sometimes even the healthiest people need medical support. So, my friends, stay informed, stay proactive, and respect your body. High blood pressure can happen to anyone, but with awareness and action, you can protect your heart, kidneys, and brain. I hope this gives you a clear understanding of why healthy people still sometimes face high blood pressure, and what steps you can take to manage it effectively. Thank you for listening, and remember, knowledge, consistency, and care are the best medicines you can have.